As a parent, worrying about the kids comes with the territory. And when it comes to a newborn baby, dealing with any kind of medical complication can be extremely stressful for everyone involved. And here to tell us about whole genome sequencing for babies and how it can provide life-changing answers to medical mysteries is President and CEO of Rady Children's Institute for Genomic Medicine, Dr. Stephen Kingsmore. Welcome to the show.
Thank you. Good morning.
So as a doctor, tell me, how often do you encounter issues with a newborn where it's tough to provide a precise diagnosis?
This is actually the leading cause of admission for babies in intensive care units throughout our state. So it's very, very common amongst critically ill newborn babies.
And is it frustrating when you can't give the parents, a succinct answer, this is what's going on?
Yes, what happens is if we don't know the cause of a baby's illness, we treat the baby for our best guess, our best differential diagnosis, and we give them what we might call generic treatment for their symptoms. Similarly to a doctor giving you antihistamines if you've got, hay fever symptoms. They're not treating the root cause of the child's illness, they're treating the symptoms.
So you believe in something called genome sequencing. You believe it's the key to help answer some of these medical mysteries. Can you break it down for us and why you think it's essential to the future of healthcare?
Sure. So the genome is the code of life. It's the blueprint for being a human being, and each of us has a unique set of DNA instructions. We read through that entire set of molecules to understand what's causing a child's illness. There are 8,000 genetic diseases. That's diseases caused by a mistake in the human genome, and they're the leading cause of suffering in newborn babies in intensive care units.
And you have a pilot program here in California. It's called Project Baby Bear. Can you tell us more about that?
Yes, Project Baby Bear is a study designed to see, is this ready for prime time? Should all of California's babies have this technology be available if their doctors are stumped, if they don't know why the baby's sick? And so over a 2-year period, with funding from the state legislature, we were able to test that out in 5 children's hospitals all around the state of California. 178 babies and their mums and dads had their genomes decoded, and we found that exactly what we'd found in previous studies panned out here. That is, that we got answers for what was causing the child's illness in a large proportion. It changed how the doctors treated the babies in hospital. It improved their outcomes, and amazingly, it also saved the state money because those babies didn't need to be in hospital for as long as they otherwise would have been.
So it sounds like you feel the project and this type of genome work has been very effective.
It surely has. I mean, what's unique about this project is it was done in the real world. Up until now, we had done similar studies, so we expected it to be successful, but they've been done in carefully controlled research settings. The legislature told us, no, we want you to prove it out in real world experience in California's hospitals. And we now have a report we're taking back to them to say we did what you asked us and the results are the same. This really is ready to be adopted across the state of California.
So you do believe that more hospitals can benefit by incorporating rapid whole genome sequencing?
Yes, there are about 20,000 babies a year who are admitted to intensive care units across our state. These are regional intensive care units, and about 1/2 of the children in those units have diseases for which the doctor doesn't know the cause. That's the set of babies who can benefit from having this be available.
Wow, some fantastic work you're doing there, Dr. Kingsmore. Where can our viewers go for more information?
If you could go to our website, which is Rady, R-A-D-Y, Genomics, Genomics.org, O-R-G. And on the front page, Project Baby Bear, click on it. It's got patient testimonials. It's got all of the facts and data.
All right, Dr. Kingsmore, thank you so much for joining this morning and sharing that information.
Thanks for inviting me.